Hello, everybody. I'm Dr. Chinyere A. Ugaji, MD, MBA, welcoming you to Dr. Chiquito Mentoring Iridescence Educational Global Collaborative Ustream YouTube Show, a Reach Higher and Let's Move initiative. Today, the 3rd of March 2015, by approximately 7:15 a.m. Central Time. Schedule of events. Highlights of the weekend. Night floats on call. UT Southwestern Career Fair on February 28, 2015 with recruitment experienced firsthand with online media and the hiring team. Birthday collaboration. Weekend collaborations and annexes. Graduate medical education question for the interviewer and the interviewee. Mini mental status examination. Case study exposition on myocardial infarction. Graduate medical education curriculum review and pain management. Graduate medical education collaboration on the national residency match policies and preparation for scramble. From the White House. Healthcare news. Globally and in the United States of America, the patient-centered medical home by the University of Alabama Family Medicine Residency, Graduate Medical Education Leadership in University of South Alabama Internal Medicine Residency Program, research opportunities from University of Cincinnati Psychiatry Residency Program, collaboration on public health with the Dallas Public Health Department on immunization, public health preparedness, and sexually transmitted disease, Director Zachary Thompson, frequently featured on media channels, Child Abuse, Sexual Abuse, and Domestic Violence Coalitions, upcoming phone collaborations, the 8th Walk South Dallas and the 8th Walk South Dallas pageant, resident life conceptualized by a 4th-year resident, Seattle track at the University of Washington School of Medicine Psychiatry Residency Training Program, healthcare in Spanish on headaches, child abuse, sexual violence, domestic violence as a public health continuum, multidisciplinary investigative consensus in research nexus globally. Highlights of the weekend. Night float on call. UT Southwestern Career Fair on February 28, 2015 with recruitment experienced firsthand with online media and the hiring team. Birthday collaboration wishes to my dad, Engineer Ugaji, telecasted live on Dr. Chiquito Mentoring Iridescence Educational Ustream YouTube Show. Collaboration annexes on Accreditation Council of Graduate Medical Education Competency Certification. Weekend collaboration and annexes with participating organizations. The graduate medical education question for the interviewer and the interviewee. For the interviewer, which could be the program director, the faculty member, the residents, the medical students, or the staff, will be how does the resident's autonomy change as he or she progresses through the program? This is a learning opportunity for the program structure on resident autonomy during the course of the graduate medical education training. For the interviewee, which could be you or me on the expedition for the perfect graduate medical education fit for our graduate medical education goals would be, what is teamwork in the concept of healthcare? And my answer to that would be, teamwork in healthcare is collaboration of interdisciplinary teams of medical practitioners from different professions, sharing a common patient population, goals and responsibility, integrating healthcare delivery models into effective healthcare delivery. Case study exposition on myocardial infarction. From last week, we talked about COPD exacerbation, and we talked about the mnemonics, BIRCHES, which is B as in BIRCHES, and that's bronchospasm, I is infection, R is retained secretions, C is congestive heart failure, H is hypoventilation, E is emboli, and S is systemic illness. So now we'll go to the next section of the show, which is the mini mental studies examination adapted, the St. Louis mini mental studies examination adapted by Dr. Chiquito Mentry Iridi Sense Educational Global Collaborative Distributive Show. And the first section is the name, which is Dr. Chinyere A. Ugoji, MD, MBA for me. Age, which is 33. Is the patient allowed, which is yes for me. Level of education, which is graduate school for me. What day of the week is it? Today is a Tuesday. What is the year? This is 2015. What state are we in? You could be in Washington, in Alaska, in Alabama, in Illinois, or in Texas. Please remember these 5 objects. I'll ask you what they are later. An apple, a pen, a tie, a house, and a car. You have $100 and you go to the store and buy a dozen apples for $3 and a tricycle for $20. How much did you spend? Well, that's $23. How much do you have left? That's $77. Please name as many animals as you can in 1 minute. I now name some animals here. So you have an ant, you have a beaver, you have a cat, you have a dog, you have an elephant, you have a frog, you have a gorilla, you have a horse, you have an iguana, a jackal, a lion, a monkey, an ostrich, a parrot, and a zebra. And that's 15 animals. 15 animals gives you a score of 3. What are the 5 objects I asked you to remember? And the answer to that is an apple, a pen, a tie, and a house. I am going to give you a series of numbers. I would like you to give them to me backwards. For example, if I say 42, you would say 24. So 87, that would be 78. 649, that would be 946. 8537, that would be 7358. The next one is, this is a clock face. Please put in the hour markers and the time at 10 minutes to 11 o'clock. And we will do that here in a minute. I apologize. Due to some technical issues, this feature is not available. The instructions are to put in the hour markers and the time at 10 minutes to 11 o'clock. And then if the hour markers are okay, that's a score of 2. If the time is correct, that's a score of 2. Please place an X in the triangle, and doing that task will give you a score of 1. Which of the above figures is largest? That's a square. The next one is, I'm going to tell you a story. Please listen carefully, because afterwards I'm going to ask you some questions about it. Jill was a very successful stockbroker. She made a lot of money on the stock market. She then met Jack, a devastatingly handsome man. She married him and had 3 children. They lived in Chicago. She then stopped work and stayed at home to bring up her children. When they were teenagers, she went back to work. She and Jack lived happily ever after. What was the female's name? Her name was Jill. What work does she do? She was a stockbroker. When did she go back to work? When they were teenagers. What state did she live in? She lived in Chicago, which is Illinois. So a score of 27 to 30 is normal for high school education. A score of 25 to 30 is normal for less than high school education. So on the next section of the show, which is the myocardial infarction case study exposition, and the definition is myocardial infarction, commonly known as a heart attack, is the irreversible necrosis of heart muscle secondary to prolonged ischemia. Epidemiology: approximately 1.5 million cases of myocardial infarction occur annually in the United States, with a yearly incidence rate of approximately 600 cases per 100,000 people. Risk factors: there are two types of risk factors. You have the non-modifiable risk factors and the modifiable risk factors. The non-modifiable risk factors include age, sex, family history of premature coronary heart disease, male pattern baldness. The modifiable risk factors for atherosclerosis include smoking or other tobacco use, diabetes mellitus, hypertension, hypercholesterolemia, and hypertriglyceridemia, including inherited lipoprotein disorders. Dyslipidemia, obesity, sedentary lifestyle, and a lack of exercise, psychosocial stress, poor oral hygiene, type A personality, elevated homocysteine levels, and the presence of peripheral vascular disease are also risk factors for atherosclerosis. What are the causes? In severe cases of acute inferior wall myocardial infarction, um, there could be insufficient delivery of blood, which results in low blood pressure. Chemoreceptor activation in the myocardium causes a reflex known as the Bizold-Jarisch reflex, which causes bradycardia and vasodilation, which leads to hypotension. Adenosine may accumulate in the infarct zone, which is secondary to a local inhibition of an enzyme, which is adenosine deaminase. There could be arrhythmogenesis, which is or simply known as arrhythmia. There could be pericarditis. There could be reduced systolic function due to lack of adequate oxygen and insufficient metabolite delivery to the myocardium. There could be abnormal regional wall motion. There could be hypokinesis and akinesis. Expansion of infarcted myocardium and resultant ventricular dilation, which ensues within a few hours after the onset of a myocardial infarction. There could also be a myocardial rupture. Ventricular aneurysm causing an outward bulging of a non-contracting segment can also cause it. Cardiogenic shock, that's another cause. Impaired relaxation with increased left ventricular end-diastolic volume and left ventricular end-diastolic pressure. Differential diagnoses include acute coronary syndrome, angina pectoris, anxiety disorders, asthma, cholecystitis, and biliary colic from the gastrointestinal tract, depression, esophageal reflux, heart arrhythmias. Clinical presentation: the symptoms which the patient normally tells you during the patient encounter is fatigue, pallor, malaise, anxiety. They kind of describe it as a sense of impending doom. Hiccuping, sweating, lightheadedness with or without syncope, tachypnea, shortness of breath. They could also have autopnea, which is shortness of breath when lying flat. They could also have paroxysmal nocturnal dyspnea, which is attacks of severe shortness of breath and coughing that occurs at night. They could also have dyspnea, which is shortness of breath or breathlessness associated with impaired breathing. They could also have tachycardia, coughing, wheezing, and production of frothy sputum, nausea with or without vomiting, diaphoresis, wheezing, chest discomfort, retrosternal chest pain, which is normally described as intense and unremitting for 30 to 60 minutes, radiates to the neck, shoulder, and jaw, and down to the ulnar aspect of the left arm. And they can describe that also as a substernal pressure sensation characterized as squeezing, aching, burning, or even sharp. They can also have an epigastric pain with a feeling of indigestion or fullness and gas. They could also have peripheral edema or described as swelling of the lower extremities. They could also have altered mental status. The vitals on physical examination, the signs that are noticed include tachypnea, tachycardia, or irregular pulse, hypertension. On general examination, they could um, um, be pale and diaphoretic. They could also and then also on vital signs they could have a fever, which is normally present within 24 to 48 hours due to elevation of creatinine kinase. Examination of the head, eyes, nose, and throat. Phonoscopic examination. You have manifestation of arteriosclerotic vascular disease, which includes copper wiring or narrowing of arterioles, cupping or loss of the margins of the optical disc, arterial narrowing, and hemorrhages and arterial pulsations. Ears, nose, mouth, neck are non-specific. Examination of the respiratory or thorax. They could have rales or wheezes, which may be auscultated, secondary to pulmonary venous hypertension, and this is associated with extensive acute left ventricular myocardial infarction. They could also have unilateral or bilateral pleural effusions, which produce egophony at the lung basis. Cardiovascular examination, they could have jugular venous distension accompanying right ventricular myocardial infarction or right ventricular failure secondary to profound left ventricular dysfunction and pulmonary hypertension. The Kussmaul sign, which is a paradoxical increase in jugular venous pressure during inspiration, occurs in patients with constrictive pericarditis, congestive heart failure, or tricuspid stenosis. Distension of neck veins is commonly described as a sign of failure of the right ventricle. Reproducible chest pain, which is intense and unremitting for 30 to 60 minutes, and that's in the retrosternal or substernal area, is also present. Pulses alternance, that's strong and weak alternating pulse waves. The variation in systolic pressure is more than 20 mmHg. The chaotic pulsation may be thin. That's described as that's known as pulsus parvus due to decreased amplitude and length of the pulse, secondary to decreased stroke volume. Pulsus bisferans. This consists of two systolic peaks, palpated in association with hypertrophic obstructive cardiomyopathy or mixed aortic stenosis and regurgitation. A bigeminal pulse is observed in the presence of ectopic beats or winking back heart block, characterized by regular coupling of two beats, with the interval between a pair of beats greater than that between the coupled beats themselves. Pulsus paradoxus is defined as a decline in systolic blood pressure of 10 mmHg or more on inspiration, and it's seen in cardiac tamponade, constrictive pericarditis, restrictive cardiomyopathy, hypotensive shock, severe chronic lung disease, or pulmonary embolism. A pulse with a sharp descent or a water hammer pulse. You could also have lateral displacement of the apical impulse, dyskinesis, a palpable S4 gallop, and a soft S1 sound. Paradoxical splitting of S2 may also be present. Increased S4 and S3 gallops are also noted. A mitral regurgitation murmur, which indicates papillary muscle dysfunction, a hollow systolic murmur radiating to the mid-sternal border and to the back with a palpable trill. A pericardial friction rub may be had due to inflammation. The patients frequently develop tricuspid incontinence. I'm sorry, tricuspid incompetence, and they might also have a hepatojugular reflux. On abdominal examination, there is a reproducible epigastric pain with a feeling of indigestion or of fullness and gas. On genitourinary examination, that's non-specific. Rectum, there is normally a positive fecal occult blood test. Extremities, pitted edema. Peripheral extremities have a diminished pulse volume, delayed rise, and delayed capillary refill, which may actually be an indication of vasoconstriction, diminished cardiac output and right ventricular dysfunction or failure. Dependent edema may be noticed on physical examination and is graded 0 to 4 by assessing the depth of persistent pitting after thumb pressure is applied to the patient's inner shin. On skin and integumentary, there could be peripheral cyanosis, there could be pallor, there could be altered mental status or neurologic examination. Psychiatric examination is not specified. Laboratory orders, complete blood count, there's decreased hemoglobin and hematocrit to rule out anemia. The platelet count is elevated. Comprehensive metabolic panel, you could see changes in potassium, magnesium levels, and creatinine level. Leukocytosis. The leukocyte count may be normal initially, but it generally increases within 2 hours and peaks in 2 to 4 days. And there's a predominance of polymorphonuclear leukocytes and a shift to the left. Erythrocyte sedimentation rate is normally increased within 3 days. It may remain elevated for weeks. The creatinine kinase isoenzymes increase within 3 to 12 hours of the onset of chest pain. It has a sensitivity of 95% with a high specificity. Troponin is also elevated. Myoglobin is also elevated. BNP level is also elevated. In some instances, BNP is less than 80 pg per mil. Serum lactate dehydrogenase level is also elevated. C-reactive protein and other inflammation markers are also elevated. Lipid profile is also elevated. Coagulation profile are also elevated. Imaging, you have electrocardiogram, which shows ST segments elevation, and also T wave inversion and development of Q waves. The ST segment elevation is more than 1 mm in 2 anatomical contiguous leads. And then also you can also see some other changes in the electrocardiogram. An echocardiogram comes in useful. A stress echocardiography comes in useful. Dopamine stress echocardiography comes in useful. Coronary artery calcium scoring is also useful. On chest radiographs, you have blunted costophrenic angles. Magnetic resonance imaging shows a dependent fluid signal intensity. Procedures include intravenous access, pulse oximetry, telemetry, and cardiac catheterization. Medications, there's a code, it's called MONA, and that's for morphine, oxygen, nitroglycerin, and aspirin. The medications include oxygen, which is 2 liters to 4 liters, aspirin, which is an antiplatelet agent, also known as Zoprin, that's 325 milligram orally. Clopidogrel, which is Plavix, that's given as 300 milligram loading dose, is an antiplatelet agent. Morphine or MS-Contin, that's 15 to 30 milligram orally, that's an opioid analgesic. Nitroglycerin, that's also known as Nitrostat, that's given 0.3 to 0.6 milligram sublingually every 5 minutes. Captopril or Capotine or Captoril, that's an angiotensin converting enzyme inhibitor, that's given as 6.25 milligram orally, followed by 12.5 milligram every 8 hours. Metoprolol tartrate, that's Lopressor, that's a beta-1 selective beta blocker. Consults, a family physician, an internal medicine physician, an emergency room physician, a cardiologist needs to be on board. Follow-up is follow-up in 4 to 6 weeks with a multi-specialty team. Coding and billing is ICD-9, ICD-10, 412 and 125.2. Billing is 99204 with comprehensive history and physical examination and moderate complexity decision making in 45 minutes. So the Powerball question, this is your chance to win a prize by being interactive on this show. And the question is approximately 1.5 million cases of myocardial infarction occur annually in the United States with a yearly incidence rate of approximately 600 cases per 100,000 people, true or false. So I want you to take a shot at that Powerball question. Contact me through our collaboration modalities and you can be able to win a prize. So the next session is the Graduate Medical Education Curriculum Review on Pain Management. And for Accreditation Council of Graduate Medical Education Competency Certification, please contact me through my various collaboration modalities. Graduate Medical Education Curriculum Collaboration, we had a collaboration with the National Residency Matching Program on National Residency Match Program match policies and preparation for the scramble. From the White House is the President's weekly address titled Ensuring Hard-Working Americans Retire with Dignity, with the main idea of financial security in retirement, analyzed with financial reform, Wall Street reform, credit card bill of rights, and the Consumer Watchdog Agency. The evidence in the financial growth, 12 million new jobs in the private sector, doubling of the stock market, and reinforcement of 401k. Links from the various ongoing statutes with the Department of Labor and the various presidential offices. Healthcare news, and I'll take a few minutes to talk about the interesting things that have been happening in healthcare. There's yeah. From healthcare news, from the American College of Physicians, there's advocacy from the American yeah, there's advocacy, and there's also important information on internal medicine meetings and conferences. Springtime in Boston, the internal medicine meeting 2015. There's lots of details on collaboration at that meeting coming up soon. There's also information about the smart testing patient vignettes, lots of clinical cases, diagnostic modalities. Um, from the American Academy of Family Physicians, there's information about the program director workshop, and residency education, um, and also details from the 2015 osteopathic match. There's also information on the 2015 national conference, with registration information, scholarship information, information about Kansas City, and also hearing from previous attendees, training your brain, making connections, exhibits at national conference, scholarship applications, lodging applications, and also networking and social events. From the Family Medicine Interest Group, you can be able to collaborate with Casey Larson. That's an FMIG Network Region 5 coordinator, on her address on the House of Delegates of the American Medical Student Association. From the American Pediatrics Association, there's information on vaccines, child nutrition, allergies, and sex trafficking. And also a webinar on coding for inpatient provided services. That was on the 24th of February, and you can be able to um, view the archived webcast. And also from the American Pediatrics Association, you can be able to share today's Facebook post with parents in your patient encounters. Um, and also, vaccination is also listed on the American Academy of Pediatrics. From the American Psychiatric Association, there's information on behavioral addictions, DSM-V5, transference-focused psychotherapy for borderline personality disorders, the social determinants of mental health, um, and then also is a research study that found that anticholinergic medications increase risk of pneumonia. From the American Board of Family Medicine, there's information about a national study by the ABFM and AHRQ in improvement of maintenance of certification. And there's a question of the week, which is an abandoned infant is brought to the hospital for evaluation based on the presence of a dried umbilical cord remnants and her overall appearance. You believe her to be no more than 5 days of age. A thorough examination is normal except for a finding of bilateral conjunctival erythema and exudate. A gram stain of the exudate is remarkable for numerous WBCs, very few of which are noted to contain gram-negative diplococci. Which of the above treatment options is most appropriate? The options are listed. Application of moist, warm, saline eye compresses is A. B is irrigation of both eyes with povidone iodine or betadine. C is a one-time application of ophthalmologic erythromycin ointment into both eyes. D is instillation of silver nitrate solution into both eyes. E is intramuscular injection of ceftriaxone or rocephin. And the answer to that is E. She has gram-negative diplococci, and that's actually treated with a cephalosporin, and ceftriaxone or rocephin is a cephalosporin. And I have a picture of that. And also an algorithm on treatment modalities. From the Institute for Healthcare Improvement, there's an upcoming webcast on March 12th, which is bundles and buy-in for value-based care. You can be able to register for that. It's a free webinar. From the Reach Higher initiative, there's success stories and collaboration with the Reach Higher initiative, the various challenges, and you can be able to watch those challenges. From the Society of Teachers of Family Medicine, there's a free online advocacy course, and you can be able to register for that. There are lots of attestations on the Reach High initiative too. From the Let's Move initiative, the Easter egg roll poster contest and the Give Me 5 campaign is still on, and there are lots of interesting recipes of the week. Barley jambalaya is listed as one of the favorite recipes. And also as part of the advocacy menage, from the U.S. Department of Health and Human Services is My Brother's Keeper, a year later, and you can be inspired by the various advocacy opportunities by tapping into that. From the Society of Hospital Medicine, North Central Texas chapter, you can RSVP for the North Central Texas chapter meeting on Wednesday, March 4th, 2015, at the DFW Center QRX Medical Management. That's on 12221 Merritt Drive, Suite 1500, Dallas, Texas 75251. That's on Wednesday, the 4th of March, 2015, by 4:30 p.m. The results meeting is today on March the 3rd at 6:30 p.m. And that's going to be at the conference room at the Mayfair 3401 Lee Parkway. For the directions for registration and for more and for information on what the agenda is going to be, you can contact me, and you are also invited to bring a friend. And then I have some sub-key recommendations on myocardial infarction. Aspirin, which should be given to all patients with suspected acute MI, is an evidence rating A. Plavix is an evidence rating B. And then beta blockers is an is an evidence rating A. ACE inhibitors are an evidence rating A, and that's to prevent ventricular remodeling. The angiotensin receptor blockers, that's an evidence rating B, and that's normally given to patients who cannot tolerate ACE inhibitors. Statin therapy is an evidence rating A, and it's recommended to start um, um, statin therapy um, uh, early during hospitalization after an acute MI, and that's an evidence rating B. A standardized patient-centered discharge process should be used in all patients who have had an MI, and that's an evidence rating C. And also counseling on diet, smoking, cessation, and also referral of the patient for exercise-based cardiac rehabilitation. That's an evidence rating A. From the National Residency Matching Program, there's information on the SOAP. There are revised SOAP tutorials, and also the applicant survey link. You can be able to take that survey and also make sure that your contact information is up to date. The Match Illuminator monthly newsletter for is out and updated from the Association of American Medical Colleges. There's information about coalition of nonprofits, foundations, and corporate giving programs with a full guide available. From the 8 Works Out Dallas, there's information about the 8 Works Out Dallas pageant, and also registration information for the 8 Works Out Dallas, which is on March 21, 2015. That's from 8 a.m. to 3 p.m. Now we'll go to the next session of the show. It's approximately 7:53 a.m. Central Time, and we'll go to healthcare in Spanish. We'll talk about headache. I'll just take 2 questions that you can be able to use to elicit the symptoms of headache from your patient during your patient encounter. And you can ask, how often do you get them? That's cuando comienzan los dolores de cabeza. When your headache starts, how long does it last? And that's con qué frecuencia usted los consigo? And that's some questions that you can be able to ask to elicit the symptoms of headache during your patient encounter. And with that, I want to thank you for being part of this show. We've talked about lots of interesting topics. We've talked about the myocardial case study exposition with a 60-year-old African American male whose chief complaint is chest pain. And you can still be able to take a shot at that Powerball question, get interactive through our collaboration modalities. And with that, I want to thank you for being part of this collaboration, and wish you a wonderful day.